I'd like to touch on a topic that's, it's causing real concern with our ICS members. Recent reports in both the Health Service Journal and the Sunday Times on ICB redundancies, coupled with the news that at least one integrated care board has already said it will not progress a redundancy scheme needed to halve its operating costs, over concerns over how that scheme will be funded. Well, this all signals turbulent times ahead. With me to discuss this issue is my Confed colleague and Assistant Director of the ICS Network, Ian Perrin. Welcome, Ian. Great to have you on Health on the Line.
Thanks, Matthew. Thanks for having me.
So, for those who don't know the story, it's a bit complicated. So can you tell us the whole story and where it is we find ourselves now?
Yeah, thanks, Matthew. So the story starts back in March this year. NHS England asked integrated care boards to cut their running and programme costs, essentially their operational costs, by 50% on average by the end of December this year. What happened after that was NHS England published a model ICB blueprint, which set out the future role and functions of ICBs. This phrase, strategic commissioning, was the headline ask for ICBs, which is a change from what they've done in the past, and set out some functions that they will continue to do and should do more of, and some functions that they should look to do less of, but will be sought to be transferred through legislation in the future. So things like continuing healthcare, infection prevention and control, safeguarding, etc. The 50% isn't a blanket 50% for all integrated care boards. So some are looking at 25 to 30%. Some are as high as about 2/3. And obviously with such a short time frame, the ambition was to look to do this very quickly. And this has caused some conversation about clusters and possible mergers in the future of integrated care boards. So we're looking at the reduction of numbers in integrated care boards from 42 down to around 27. This is all about helping to achieve financial balance and to invest more in the front line for patient-facing services. So where we are in this, in the journey of this kind of issue has been the kind of cost and the numbers of reductions being sought across integrated care boards risks putting them into deficit for this financial year, because it's something that wasn't planned at the start of the financial year in terms of financial planning. So
is that mainly redundancy costs? Yeah.
This is mainly redundancy costs. Yeah. And we're talking for different integrated care boards, hundreds of staff. So in total, thousands, and costs looking up to £50 million we've heard cited with our members, figures in the region of 30 to 40 for others, £1 million. So big cost for integrated care boards, and some have ballparked the kind of total figure at about £1 billion. So really significant, and not something that was forecast at the start of this financial year. What that means is plans for redundancies have to be approved nationally by NHS England and the Treasury. And a conversation with the Treasury happens on whether or not funding can be provided centrally to help cover the costs so that systems can remain in a financial balance for this year. Those processes have been quite slow for this year. So understanding exactly what can be provided centrally and what can't is still an ongoing debate. I understand NHS England are in negotiations with the Treasury at the moment, and the process for signing off redundancies has been stalled. So systems were ready to go with their redundancy schemes in July. Have been really working at pace to form these clusters to figure out how they can deliver the future role within what is available to them, but are waiting really for national teams to press ahead with this. So our ask and what we've been pushing for nationally has been to speed up the processes as much as possible to allow ICBs to deliver what can be delivered this financial year, and then look to next financial year to deliver what is likely to be the bulk of the redundancy programs, largely because the ability to pay for it within year is slipping away as the year goes on.
Thanks, Ian. So, as is often the case, there's kind of the big issue, but then there's smaller, more kind of specific issues that emerge out of this. So, tell me if I'm right about this, is intermediate 2 or 3. So one is that if the money is not provided for those redundancies to be undertaken this year, that will mean that cost goes into the next financial year. And it's already incredibly difficult for ICBs to see how they can get to the £19 per head limit that they've got for next year. So one issue is if you don't do it this year and you don't get the support for this year, then it carries on into the next year. A second issue is the kind of the consultation with staff, because this is covered by employment legislation, by agreed rules around these things, and the timescale means that you can't start that consultation process formally until you know that you've got the money for it, which is another thing that delays things, but also has an enormous impact on staff, because we're talking here, as you say, across the country around thousands of people who've given many, many years to the health service in this kind of terrible limbo. And then the third element, if I get this right, Ian, is that in those ICBs that have been clustered, where obviously there's a change of executive leadership, because, in some you're talking about 3, I think even 4 ICSs, or certainly 3 ICSs coming together. So, there's going to be only one chief executive out of 3, etc. The executive redundancy package, which is, probably affordable, has to actually formally be approved by the Treasury, because I think because it's people on higher salaries. And that's just stuck in the bureaucracy of the Treasury. So they can't even undertake the executive redundancy package, without which it's very hard to take the kind of next steps in the process of reorganization. Is that a fair account, of some of the other kind of particular issues that have dropped out of this?
Yeah, that's absolutely right, Matthew. I remember you used the metaphor a couple of days ago that we sort of suggested that perhaps they were on a roller coaster, and I think they suggested that actually they're not on the roller coaster yet; they're waiting in the queue, because they're not able to yet to press ahead with these schemes and waiting for sign off from the Treasury. So absolutely, that's a big issue. We're also hearing that those ICSs that are clustering, as you say, this is just a much more complicated process for them. So those that are staying the same boundaries with the same population coverage are essentially further ahead in the process. And that means further ahead in the process for becoming strategic commissioners and cracking on with work to deliver the ambitions in the 10-year plan. So there's an element of a staggered start for different ICSs in this process. And as you say, the impact on staff is massive. We've heard reports of from our members of staff sickness rates increasing, anxiety, really high at the moment, as you would expect, and unsurprisingly, really. And then also there's a risk that this process goes over winter, which I think was something that everybody wanted to avoid at the start of this process, and that will, obviously have an impact on delivery of winter plans over the course of the winter. So trying to get some certainty as much as possible now, which is what we've been pressing for, about what the new timelines can look like, what is a realistic ambition to deliver this, so that staff can focus on the challenges right in front of them and come to this stuff as soon as they can.
Yeah, and just to kind of finish, Ian, I think that the longer this goes on, the greater the risks. And I think there are short-term and medium-term risks. The medium-term risk is ICBs are actually very important to the 10-year plan, not just strategic commissioning, but market making. They're critical to brokering, who's going to be the multi-neighbourhood provider. Later on this podcast, we're talking to Andrew Bland, who's done fantastic work in South East London, an ICB that isn't having to cluster at this stage. We want ICBs out there making the 10-year plan happen, but it's difficult to do it when they're in this situation of chaos. But in the immediate term, as you've said, when organizations have important responsibilities, are in this kind of limbo, in this kind of chaos, there are inevitably risks that emerge from that in terms of their capacity to undertake their kind of day-to-day responsibilities. So we can only carry on, Ian, can't we, pressing the centre to be realistic and to be reasonable and to try to resolve these issues, well, now.
Yeah, that's absolutely right, Matthew. And we're working really hard to try and make sure that that happens and to ensure that our members are part of the process as well, so that they can raise these issues as early as possible. And, inevitably questions come up here and there throughout the process, and making sure that there's as much clarity as possible is absolutely crucial to this.
Ian, thanks so much for joining me.
Thank you.